put the thing in, but you need to keep them at least semi-phallus. Anytime they're being fed through a tube, you're gonna keep them at semi-phallus. This is to help prevent aspiration, okay? So, doesn't he look terrified?
I know.
That's right. Okay,
What's up
now,
with his teeth?
at one point, you're going to have him taking sips of water with a straw or without.
With
What's gonna decide that?
The patient.
if they're
Speech therapy.
Have you had bariatric surgery? Yes? Okay. No straws for the rest of your life. Okay? Depending on what kind of bariatric, but in most cases.
Because you can burst the
Because
stomach.
you
by
can
drinking
introduce
too
so
much.
much air in and it's very painful. I had to ask a bariatric surgeon what the reason for that was, because it made no sense to me.
so what is
Okay.
because you introduce too much air into the stomach?
And that becomes really painful in the smaller area that you have to work with now. Okay. I don't know if a person never burps again or what. Okay, so here's your patient. All right. And you're going to ask him several questions before you start. Have you had nasal or sinus surgery in the recent past, meaning the last 6 months or so? Now, why is that? Because there may still be damage in tender tissue in there and you're gonna be going past it. Also, because with sinus surgery, the thing can go the wrong way and end up coiled in the sinus. Okay? So, that's one of the questions. What else would you ask him?
Does that include like deviated septum, or would that be a
Yes.
separate?
Do you have a deviated septum or polyps in your nose? Okay? This is anything that could block you as you try to go in. I actually have a deviated septum to the left. If you try to put an NG tube through my left nostril, I'm gonna punch your lights out because you're gonna be trying to go through tissue. Okay? And then the third thing is about bariatric surgery. And the only difference that's gonna make is you're gonna take this straw off. Now, in terms of if you draw this scale for your pass off, when you ask that, I'll answer for your patient. He has or he has not to watch whether you take the straw out or not. Okay? All right. So we're going to have our towel ready to go over him. And we're going to give him the basin. If he throws up, how much use is this gonna be? They call this an emesis basin, but that's a joke. You can use it for brushing teeth, but it's sure no good if the patient actually throws up. Give him a big basin. Give him one of the wash basins, the plastic wash basins. So if he throws up, and sometimes they do, if there's a lot of pressure built up, and that tissue hits there and opens things up, and they just go, whoop, and then you
Does
have
it make him gag too? Maybe not that
They
way.
can gag, yeah, they can certainly gag. So we're gonna give this to him, okay? And we're going to tear a tape. Now, remember, you don't put tape directly on the table, you put tape on tape. So I'm gonna put a piece of tape, and please take these pieces off when you're done. And I'm gonna have a nice long piece. And I'm gonna have a shorter piece. And I'm gonna have a little tiny piece. And then I'm gonna make a shirt and pants. So now, what I'm gonna do with this, I'm gonna tear it in half part way. This one isn't tearing very well, but okay. And what you end up with is a shirt and pants. Okay? All right. I'm going to get this out. And I'm going to get my gloves. It's so much fun being short.
Now, in real life, would you put the gloves on before or after you take the stuff out of the packaging?
It doesn't matter.
Okay.
Is this a sterile procedure in any way, shape, or form?
No.
You're working with the dirtiest system in the body. From mouth to anus, dirty. Okay? Doesn't matter. If you know, you want to keep it as clean as you can. I could keep this on the wrapper.
Right.
But I'm gonna be handling it with my gloves a lot. It can get against his gown. It isn't gonna be at all sterile. Okay, now I can put my gloves on now, or I can wait until I'm ready to actually put it on, to actually put it in. The first thing I'm gonna do before I put it in is I've got this little piece, which is hollow. This is important to use when you're attaching this to suction so that the stuff flows through the tube right through this into the suction collection. Okay, so I can actually take my suction tubing and I would go ahead and attach it to that and just put that so I know where it is. Okay. Okay. Then I have this one. And this is an anti-reflux valve. And this one goes blue to blue, is how you can remember it. Okay, this one has holes on one side, so it allows air intake, but it doesn't, it's closed on the other side, it doesn't allow anything to come out. Okay? Now, since I'm suctioning, I need to have an air intake or the whole thing just collapses, even, although this isn't likely to collapse, it's pretty tough. All right? Then I have my piston syringe, and I can go ahead and open it to about 20 to 30 milliliters and attach it to the tubing. So it's ready when I am. Okay?
You said 15 to 30.
20 to 30 milliliters. You can do as little as 15.
Okay.
Yeah. Okay, now I need to see how far down I need to put this to be in the stomach. So before I'm putting it in, I need to measure it. The way you measure, turn his head, you're going to first check, and you can have your gloves on for this if you prefer. Close one nostril, sniff. Close the other nostril, sniff. Whichever one is clearer, whichever one sounds clearer when he pulls air in, is the one you're now going to block. Aren't we kind? Okay. So, and I can't turn his head the way he's positioned, but you take it from the tip of his nose to the bottom of the earlobe, straight across the face, okay? I don't know if you can see that, but it's the bottom of the earlobe, okay? I'm holding it to the bottom of the earlobe. Then you come down from there to the bottom of the, what's that bone at the bottom?
Xiphoid process.
The xiphoid process, okay? And she doesn't have much of one, okay? Then from there, they used to say that's how far you put it. And then they discovered that in some people it wasn't in the stomach at that point. It wasn't actually in the stomach, it was still in the esophagus. So they really didn't want to start suctioning or feeding with it still in the esophagus. So now they say, good idea, take it 4 to 5 inches beyond that. Okay, that's up to 10 centimeters beyond that. That's 4 inches, would be 10 centimeters, 2.5 per. So roughly 4 inches past, and then you're gonna take that tiny little piece of tape, or you can use a Sharpie, but you are going to mark it. Now, if you're using a Sharpie, you wanna use one that's some color besides black, because there's already black markings on the tubing, and you wanna be able to see which one's yours. Okay, this particular one is marked, so you can see how far in you're going. All right? And now, we are going to lubricate this, and you will normally use Surg-lube. We do not on the mannequins because that gets inside and then it's a mess. So I'm going to lubricate this. Now I'm ready to go, so I'm going to put my other glove on. If you want to have both gloves on before now, no problem. This is one of those things, the gloves are one of the things which on most of those rubrics, there is some flexibility on when you put them on, as long as they're on before you get into the part where you may be exposed to stuff. Okay? Now, the other thing I need to do at this point is to go ahead and bring the towel up, because it can get messy, and give him the basin. And if you've got a walkie-talkie patient who can help you, give him the water. And this guy has not had bariatric surgery, obviously he still has a straw. Okay, we're gonna bring this up. And at this point, it may help you with your live patients to take the pillow out until this one's in, because he doesn't have a lot of flexibility and you need his head back to start. Because you want a straight shot basically from the neck to the pharynx. Okay? So I'm going to bring this over, and don't be shy about doing this. Don't inch it in. All you're doing is prolonging the discomfort for the patient. So I'm going to go straight in about 6 inches.
Swallow.
Okay? You will generally feel when you hit the back of the pharynx, and the patient may cough just a little bit. Okay? You pull it out just to here. Let them relax for a minute. Now their head is going to come forward, and they will take the water to their mouth, and they will begin to swallow little sips of water. And with each swallow, go down. Okay? So now it's going to be glug, glug, glug. You notice I'm not letting it slip out in between. Glug. And these guys pretty much won't go anywhere near as far down as you marked. They're blocked off at the bottom. So we're going to say we're there. Okay? Now, I want this to stay there, and I'm at about 40. I actually need to be closer to 60, but I'm going to say I'm there, and you don't want this to slide out while you're checking things. So we're going to bring it over here, and we're going to take that nice long piece of tape. I really want both of them, thank you. We're going to take that nice long piece of tape and we're going to tape it to him. Okay? Now, I've already got this here. There's 3 tests. The first one is you now have your stethoscope. That will be part of, by the way, part of your equipment. So you need to be sure to bring your stethoscope as well. You will place the stethoscope roughly at the top of the stomach, left upper quadrant, and inject air rapidly. And you should be able to hear the air come in here. This is no longer considered an accurate or reliable test. So this is one that in most hospitals they don't do anymore. Okay? If you're doing it at home, you might need to. You're going to do what you're going to use what you have at home. Okay? Now, the next thing we want to do is to pull some fluid out. This is assuming he isn't under such pressure that the tube isn't already all full. Okay? So what you can do at that point, and again, pH paper is not something you're going to be using in the hospital, but you can use it at home. And you take a little piece of pH paper, tear off just a little piece of pH paper, put it in the bottom of a med cup, and now I'm going to suction some fluid out. Now, if I'm not going to test it with pH paper, all I need to do is be able to see it come out. It doesn't have to come clear down the tube. Okay? But what you will often have is some fluid in here. So any stuff that does come out, if it's going to be, well, it's going to be suctioned anyway, it doesn't matter. It can stay in the tube. Okay. But you can also, if you have a lot, you can use the air at this point that you had in here to push it back up so you can quickly detach and attach with less chance of spillage. Okay, so we now see stuff coming out. What color would we expect it to be? If it's just stomach juice, what color would we expect it to be? If it's the acids.
Yeah, isn't it like a murky
What
yellow?
color? Okay, yellow, golden yellow, something like that. Your basic hydrochloric acid is kind of a golden yellow, but it might be other colors too. For instance, if bile has backed up in the stomach, it may be green. If there's a lot of bleeding, you may have red or brown. So what you expect though is you're gonna see something with color, okay? If you're getting nothing or clear, you're probably not in the stomach, because there are juices in the stomach, okay? So we're going to pull until we see something, then let's assume that, let's just say for argument's sake, he had a lot of pressure, this whole tube's full. The main thing I need to be watching for now is that I don't get a lot of spillage. If I just pull this out, here it comes. So anytime you are having the tubing open, you must crimp it off, okay? And if you ever forget that, you'll never forget it again, okay? So we're gonna take this off. Now I have a tiny bit, if I'm using pH paper, I have a tiny bit of the juices in here, and I put it into that cup and see what my pH is. What pH would I expect if I have stomach stuff?
4.
Probably 4 or less, okay? So I would expect it to be orange to red, all right? All right, then I'm going to use my little anti-reflux valve. And now, I don't want to just leave it taped like this. I've checked pH, and pH is like 99% dependable. So if you're doing this at home, this is at least 99% dependable. Seeing the colored stuff, I have now verified in at least 2 ways I'm in the stomach. So I'm confident enough that I'm gonna go ahead and put a dressing on, okay? Now I can use my pants and shirt at this point, okay? And the shirt goes on his nose, and the pants wrap around the tubing. One goes clockwise, and the other goes counterclockwise. There we go. Okay, it's not going anywhere. Now, if you use their dressing, it isn't as complicated as that in terms of getting the 2 legs wrapped around because they're much shorter. You were up all night studying, weren't you?
I was sorry, I was so anxious I didn't sleep.
Okay, I'm trying to get this open. There we go. This is a knuckle bandage and it works very well. The actual bandages for NG tubes look like little dog bones. You put one end of the dog bone on here, the other end wraps around the tube. Okay, but this can work the same way. You can put this on here, wrap these 2 around the tubing. So a knuckle bandage can also work. You have a variety of things that can work in terms of some kind of dressing that's gonna hold it in place. Okay, now we can get these things out of the way.
Does it matter which one we use when getting tested?
I'm sorry?
Does it matter which one we use when getting tested? Can we use the knuckle dressing or the tape? It doesn't matter.
You'll use what they have at your facility.
Or the test will leave the pants.
Okay, so we're gonna take this off at this point. Now I have one more thing to do before I do the final verification of placement. I'm gonna take that last piece of tape that I had. I'm going to create a flag on his tubing, and I'm going to take that safety pin and I'm going to pin this to his gown in such a way that you see I'm leaving some give here. So I'm going to pin this to his gown. Not your finger, and not him. And this is a very dull safety pin. Okay. Now, am I ready to use this thing?
No, the X-ray.
Excellent, yes. Your final and the gold standard is this must be X-rayed before it's used. The ends of these tubes are radio opaque, so they can see exactly where the end of it is, and be sure it's where it belongs before you start using it. All right. Now he's come back, so at this point, if you were doing the test, you would say, and then I would send him down for X-ray. Okay, and then X-ray done. If you're going to attach him to suctioning, you want the hollow one now, but you also don't want any drainage out of this one, so we're going to leave the anti-reflux valve in here. I'm going to clamp this off, pull this, put this in instead, and he's ready for suction. Okay? Now, when this is ready to come out, the doctor may indicate what, again, you're going to be keeping track of the amount and the coca, because it's going to come into here, and at the end of each shift, the nurse will mark where it is at the end of her shift, and then you can see between there and where it is at the end of your shift how much there has been. So that's how you get your amounts. Now, what the doctor will say is, as there's less and less suctioning, he may tell you to go ahead, take it out, give it a few hours, and if nothing happens, if the patient doesn't start bloating or becoming uncomfortable or whatever, then you can go ahead and take the thing out. Now, let's say we're ready to take it out now. Disconnect from the gown. Okay, I'm not gonna worry about the tape now, but please take all this tape off before you give the thing back to us. I'm going to have a towel over him, because it's gonna get messy. And I'm gonna give him a big wad of Kleenex, because sometimes when you pull this out, there's a lot of, I don't know a better word than snot that comes with it. And so he has a handful of Kleenex to use, okay? We're going to detach it from his face. And this does not have to be this long on a real person, it's just it won't stick on him if you don't have a big long one. Okay, and I'm going to free this up, and you don't have to worry about taking it off until, for our purposes, you will take it off when you're done. But for the purposes in the hospital, all you want is to get it detached from him. Now you've still got him sitting up. He's got his Kleenex, he's got his towel. And you're gonna say, take a deep breath and hold it, increases intrathoracic pressure, gives, distracts him from what you're doing. And we're gonna take it out, and again, don't be shy. Okay, you ready? Let's go. Okay,